Welcome to episode 227, Supporting Clients Through Gender-Affirming Surgery, Resources, Preparation, and Interventions, featuring Zander Keig, licensed clinical social worker. Make sure to subscribe to be alerted about future episodes. By Clearly Clinical, learn, grow, shine. Hello to our listeners. My name is Beth Irias, and I am so excited to be joined again by Zander Keig. Zander is a licensed clinical social worker, and he has been instrumental for particularly the trans community in the United States and his work with supporting clinicians in being more competent in working with gender diverse individuals. And I'm delighted to introduce you again to Zander Keig. Zander, thank you so much for joining us.
Absolutely. Thank you for having me back.
So today we're going to be talking about surgical considerations. Goodness knows that for gender diverse clients, these conversations can be really complicated and also so many considerations. And I'm delighted that Zander agreed to come on and talk with us about this today. And for our listeners who are not familiar yet with you and your work, Zander, can you please take a moment and tell our listeners about you and what you do?
Sure. Well, I'm a licensed clinical social worker. I live in Orlando, Florida. I primarily spent my social work career working with veterans and military personnel and their families at the VA and the DoD. In both of those settings, I had an opportunity to work with transgender individuals. At the VA, I was part of a national work group for LGBT patient care, and that work group, was responsible for creating and annually or semi-annually updating or revising the policy that extends benefits to transgender veterans, also LGBT veterans, but that's a separate policy, and creates training programs for staff on how to work with trans veterans at the VA. And then at the DoD, I was there for about a month when the policy came out in 2016 that said that transgender people would be able to serve openly in the military. And so I was called to a meeting about a week or so after that policy. Well, it wasn't really the policy yet. It was a memo announcing that the policy was changing. This was in June or late June, early July of 2016. And what was happening was the Department of Defense had decided that they would create what became known as transgender care teams or transgender multidisciplinary teams, dependent on the branch of the service, to process the requests of active duty service members who wanted to do a gender transition on active duty with command approval. And so I was at this very pivotal meeting, and the acting commanding officer at the time, she selected me to be the case manager for what became the Navy Medicine West Transgender Care Team. It was the first military transgender care team to be stood up, as we would say in military terminology. And so I was there from the very beginning, figuring out what all the different medical disciplines that should be involved in the care team. I created the intake and the orientation process. I single-handedly worked with upwards of about 300 active duty service members during a 3.5-year period of time. So between 2016 and 2019, I was involved with that effort. I'm a trans man myself, and so I've also been through a medical transition and also a legal a transition, so to speak, and a social, because they all come together, especially if you're doing medical, right? There's a lot of different elements that come along with that. And so, yeah, that's a little bit more about me.
Fantastic. Thank you, Zander. There is so much to discuss in this conversation today. And before we dive in, one thing I want to share with our listeners. Today, we're going to be talking more about kind of the ins and outs of surgery, a client's decision-making process, and then also what may come up for this person as they're processing this, like what are the financial implications? How may it affect their family planning, things like that. And what we are not really going to be focusing on is letter writing, which is another conversation that is very important, but just to kind of get it out there, we'll talk a little bit about that. But I want to really focus on the surgical procedures themselves and how clinicians can really understand, because there's so many considerations. So with that said, Zander, where do you think we should start today?
Well, there's so many different kinds of surgeries. right, that our clients may be considering. And there also might be surgeries that they aren't because they don't know they exist, right? A big barrier for people might also be thinking that their insurance company might not cover it or they can't afford it. So but there are some, over the years, there's been the development of some funds that help people cover surgeries that aren't covered, that the insurance company won't pay for. So when we talk about surgeries, there are a number of different surgeries. And right off the bat, I'll mention a website that would be helpful for people to go and look at, which is transhealthcare.org, transhealthcare.org, because on that website, people can look up surgeons that perform different surgeries, gender-affirming surgeries, all around the world. So it's not as if people have to spend a lot of time trying to find a surgeon who does the kind of surgery they want to do. This website takes people to various other websites that are all trans surgery specific, that were all designed by a trans man who built all these websites and has been running them for a number of years. So, and they're kept up pretty regularly. So there are going to be three major buckets of surgery types. There's going to be surgeries that trans women or trans femmes or MTFs, there's a lot of different language that gets used, that are going to be mostly interested in. And then there's the people in the trans man or trans masculine or FTM community and those surgeries. And then more recently, surgeons have started devising or developing surgery techniques that may be of more interest to people who are non-binary identified. And so within the camp of surgeries that, let's say, a trans woman might be interested in, that would be breast augmentation, which is a procedure that a lot of plastic surgeons do. That's not an uncommon procedure to do for most plastic surgeons. There are plastic surgeons who specialize in breast augmentation. Now, they might not have ever done it on a trans woman, but I don't think you necessarily need a specialist for that, but there are people who specialize in doing breast augmentation surgeries for trans women. And this is the insertion of either saline or silicone implants. And then there are what would be called facial feminization surgeries, right? So that could be anything from changing the size of the brow, the bone above between the scalp and the eyebrows. There might be also a surgery to reshape the face. There's also a surgery that will remove part of the Adam's apple, right, to shave down the Adam's apple so it's not so prominent in the neck, not as visible or visible at all if they shave it down. There's also vocal cord tightening that can happen so that the pitch of the voice can change for trans women to speak in a register that would be considered in a more female register of voice. Again, this is not something that all people do, all trans women do. But these are some of the surgeries that are offered. There's also vaginoplasty, which there's multiple different procedures for that. We won't go into all of those, but that's why if somebody goes to the transhealthcare.org website, they can click on a link that's labeled, vaginoplasty surgeons, and they can learn everything they want to know about that surgery. And then, so I think those are pretty much the major ones. There's also going to be different other kinds of plastic surgery that people might want to do, but those are the basic ones: breast augmentation, facial feminization, vocal cord, surgery, and then the vaginoplasty. On the trans man side, there's going to be top surgery, which is kind of a euphemism for double mastectomy, with reconstruction. So a standard double mastectomy is what would be given to a woman who is either diagnosed with breast cancer or is having a surgery as a prophylactic because they are at a high risk for breast cancer. So there's not a lot of reconstruction that goes on with that unless there's implants put in. But with top surgery, it's a double mastectomy, or there's also another procedure called a keyhole for people who have smaller chests, where they're going to replace where the nipple and areola are, and they're gonna do it in such a way, they're gonna reconstruct the chest in a way that it has more of a what would be considered like a standard male appearance if you go without a shirt. And then there's also what a lot of people would just call hysterectomy. I forgot. There's also another procedure that trans women might get, which is called an orchiectomy, where you remove the testicles, and perhaps the whole the scrotal sac as well, but definitely the testicles. And on the FTM side or trans man side, hysterectomy, which is used as a catch-all phrase, but it really isn't. A traditional hysterectomy is just the uterus and the cervix. If you want your ovaries and your fallopian tubes removed, that's another procedure, salpingo-oophorectomy, bilateral salpingo-oophorectomy. And so oftentimes people will go to get additional surgeries, what we call bottom surgeries, which I'll tell you about in a second. And the doctor or the surgeon will say, have you had a hysterectomy? And they'll say, oh, yes, I've had a hysterectomy. And then when they get in there, they'll realize, oh, the ovaries and fallopian tubes are still in there, right? And they don't have permission, perhaps, from the insurance company to take those things out. So they have to work really rapidly to get some approval for that. So when people are going for a hysterectomy, they need to make sure that it's taking out what they want taken out. Otherwise, it might be just a partial, the standard hysterectomy. And then there's also what is euphemistically called bottom surgery, which is genital reconstruction surgeries. There's two different kinds for the FTM side of surgeries. There's something called metoidioplasty, which is the lesser invasive surgery, and then phalloplasty. And both of these surgeries are to construct an organ resembling a penis. And the plastic surgeons who do these surgeries have gotten better and better and better at these surgeries. And so they don't even approximate the look of a penis anymore. They look exactly like one. They know what they're doing nowadays. So those are the basic surgeries. On the non-binary side, some of the interesting things might be an orchiectomy for a non-binary person, right, who was assigned male at birth, who just doesn't want all the heavy dose of testosterone that's emitted from the, I don't know if emitted is the right word actually, but from the testicles. So they might get an orchiectomy. On the FTM side of things, or not that, I mean like non-binary but female assigned at birth, they might get a chest reconstruction surgery and then maybe leave off the nipples and areola. It'll look more like a Ken doll chest. And so that's something that's become more and more popular. And I've noticed that more surgeons who do top surgery are now adding this non-binary option for people. So those are the basic, like 3 categories, and then the various surgeries. There's others, but we could go on and on about the different types of surgery and what they all mean and look like. But again, at that website, which is transhealthcare.org, there's a vaginoplasty surgeons link, there's a top surgery link, and there's a phalloplasty link. And then people can also then find metoidioplasty surgeries as well.
Thank you, Zander. In and of itself, we could do an episode, an hour long, just about one single surgical procedure and discussing what that looks like and what recovery looks like and considerations. So knowing that really for the purposes of this conversation, it's really a 101, if you will. All of these things are inherently invasive. Surgery is not fun. The recovery is tough on the body. You've mentioned kind of the insurance consideration. I want to talk a little bit more about that. As someone who has specialized in working with people who are part of the gender diverse community, I'm curious for you, like how and when do you bring up surgery, or do you feel like a lot of your clients come in and say, I want to talk more about this. I think this is something I'm interested in.
I haven't done gender therapy in a little while now, but when I was doing gender therapy and when I worked on the transgender care team, generally speaking, people already had in mind that they wanted to have surgery. As a matter of fact, as a gender therapist, people were coming to me specifically because they said they want to do surgery and they wanted a letter. They needed a letter, right? The surgeon was saying we need a letter from a mental health provider. So they had a general idea. But, I did realize pretty quickly when I would do a simple probe, oh, yeah, which surgery? Who's your surgeon? And they were not always familiar with the different procedures. They weren't familiar with the different surgeons. They would say things like, "Oh, I'm gonna travel to this other state because nobody here does it." And this is when I was living in California, and I was like, "Oh, well, there actually are many surgeons within the state who do it. As a matter of fact, within this county alone, where I was living at the time, who do that surgery." So what I realized is that people were getting information about surgeries through either Facebook groups or, because this is also, going back a little ways, they were getting it mostly from Facebook groups. And so they saw videos maybe of people talking about, or they read passages that people wrote about who they went to see and how much they appreciated, their surgery outcomes and the surgeon themselves. And so they got in their mind like, oh, I want to go to that surgeon. But I had to tell them, okay, well, I didn't tell them, but I had to walk them through the process of, are you using insurance to pay for this? Will your insurance send you out of network? Right. So there were a lot of questions about that. The other thing, too, is that there's one thing to be said about knowing as a trans person you want to have surgery and then making that declarative statement out loud, right, to a therapist, I want to have a surgery. It's a whole nother thing to talk about the readiness and the preparedness for actually having the surgery, right? Because most people that I talk to, because I still talk to people, I mentor people, I go to conferences, I still talk to people who are having these conversations. And what's clear to me is that most of them have never had a surgery before. They don't know anything about general anesthesia. Nobody's really talked to them yet about having a support network set up to provide care for you after the surgery. So we might be getting into some of these things in a little bit, but it's like, what I've noticed is that there can be, for a short period of time for most, but an extended period of time for some, where the only focus is on, I have to have the surgery. And all the other factors are either not considered or just dismissed, right? Like I might say, well, it might be helpful for you to, read this book that's specifically written about, the top surgery experience and the questions you might want to ask your surgeon and the items, the supplies you might want to have at your home for when you come back after the surgery. And I've heard people say to me directly, oh, I don't need that. Right? I don't need that. I have some buddies. They went through surgery. They'll tell me all about it. And it's like, well, sure, we have buddies. They've been through the surgeries. And there's going to be, it's almost like, for women, you have a baby and then for some reason or another, you have another one because you've forgotten what that first experience was like. Right. And so I think there's something to say for, not that having children isn't wonderful and beautiful, but you know what I mean? It's like there's so much that's unknown about pregnancy and childbirth. So this is similar to that. There's so much unknown about surgery and post-surgery, and the information that your friends can share with you that you can get from the internet is going to be missing. There's going to be gaps in that information, a lot of gaps. And so when somebody takes the time, a social worker, by the way, takes the time to write a book, like Unbound, everything you need to know about top surgery kind of book, it might be worth at least checking it out. And
I love that, Zander. I'm really glad you brought up that point. And I want to piggyback on what you had said about finding a doctor. That's been my experience as well. in working within this community and also talking with clinicians who work with gender diverse clientele. You're right that a lot of the information is coming from various social media channels, and that doesn't necessarily mean that the information isn't helpful or that it isn't accurate. Many of us rely on those resources for various things in our lives. And it's also been my experience, just as you said, of there are holes in that information. And sometimes we're overlooking what may be available because we put out a post, no one responded, and then we say, oh, well, there aren't any doctors here, or there aren't any grants available in my area, or my insurance definitely won't cover it. And we kind of run with that. And I can understand that. I think that happens a lot in social media, and I appreciate what you're saying because it effectively puts a clinician in a little bit more of a case management role to say, let's do this together, or here are some resources that I can offer to you. And that's been my experience working within the LGBTQIA plus community, is making sure that your resource list is up to date and that you are connected with other professionals who can help you facilitate the right referrals, because they're out there. Oftentimes we may just not know about them.
Absolutely.
And you had brought up the kind of support community part. Again, piggybacking what you said, that's also been my experience. And it's like the surgery, and then it's like, and then there's a recovery, and I'll worry about that later. And I'd like to spend some time there because we're really talking about different stages of, there's like this stage of, okay, I can do this thing. I've learned about this surgery, this procedure. I'm interested in doing it. Then there's the payment. There's a potential authorization with an insurance company. Do you need to have travel arrangements set up? What about aftercare? How much time are you taking off work if you're working? What about missing school? Like all of those things, just kind of preparatory. Then there's the literal surgery. And then there's the aftercare. These are not necessarily easy recoveries. Like some of these procedures can be very debilitating. So let's talk about kind of that first stage of going through that client statement of, okay, therapist, I think I want to do the thing. And then you say, what thing? And then you go through everything you just said, like, here are all your options. How do you handle it from there?
Well, some people are going to be very excited, and then others might be really nervous, right? And so, because there are a lot of unknowns about surgery, just think about, people hopping on a plane. People are excited to go traveling, but if they've never been on a plane before, they might be nervous about flying, right? And so I think surgery is the same way. So we're going to have clients who are going to present to us with various emotions: excited, nervous, I don't know. They might have trepidation, right? Right. So because for them, it depends on where this desire for the surgery is coming from, right? If it's coming from an internal place or an external place, because I think that sometimes people feel they have to have surgery because, well, everybody around me is having surgery. I want to have surgery too. I don't want to be left out, or, I want to be able to fit in with this group of people. Belonging is really important. And so if all of a sudden, your friend network, like your peers that are trans and they're having surgeries, that can leave some people feeling like, I've heard people for 20 years now using the phrase, I wonder if I'm trans enough, right? And so if the trans people around you are having surgeries, and at that point, you're thinking, oh, I'm not interested in that yet or ever. And then all of a sudden, people around you are getting it. It might put a little gas into that. And so I think it's worthwhile to talk to people about, is this desire for surgery an internal desire, or is there any external factors that are mitigating the decision? Because that doesn't necessarily mean that they're not going to go forward with the surgery. You're going to discourage them from it, but it's just helpful for them to, I think, to try and find an internal place for that, because I think it's going to make it's going to make the waiting period probably more manageable, because some surgeons have up to a year-long waiting list, right? And so It's also going to make, going through the surgery and then healing from that surgery, recovering from that surgery. I think we're going to have a closer connection to all of that if we're being driven internally to have the surgery. There's also the issues of talking through what is going to be the right surgery for your body, right? That also is different. And also the person's interest in, like, so for example, you could say, yes, there's for trans men or FTMs, non-binary people, there's, chest reconstruction surgery. And so there's all these different little pieces to it. So people actually have the option to tell the surgeon, like, no, I don't want you to resize, for example, the nipple or the areola. I want you to leave it the size it is. Whereas typically, if left unsaid, they're just going to resize it to what is considered to be like a male chest, appearance. And so people need to know that they have some agency in the different elements of their surgery procedures. It's not just, oh, I'm going to go to that doctor and they're going to give me that, generic surgery. It's like, no, it depends on the size of your chest to start with, and then what you want, and so that's why it's important to have a broader exposure to ideas and people who have had these different surgeries. So I think that's where a clinician can come in and say, I highly recommend that maybe you join one of these Discord groups or Facebook groups, or now they even have virtual Zoom rooms where people are coming in to talk about, I'm considering surgery, or I'm scheduled for a consult, or I just had my surgery, right? There are different places on the journey, and they can connect with other people who are in that same place, and maybe even further along, so they can, share wisdom across those various parts of the journey. So I think it's helpful, to be able to talk people through their decision-making process so that they can get everything set in place before they go to the surgeon. We can ask them, well, what questions do you have for the surgeon? Because a lot of people would just walk in and just listen to what the surgeon has to say and not ask the surgeon any questions, like to see examples of post-operative outcomes, to ask about, how long the healing process is going to take. I mean, people tend to be a little nervous around doctors, and so it's understandable. So that's why it's good to prepare in advance.
You just brought up so many good points. Thank you. The preparing question piece, I want to spend a little bit of time there. I think you're right. And also, how many times have people in marginalized communities had bad experiences with doctors? And so even if a doctor's name is on a list that they are affirming and that they're doing these procedures, that doesn't necessarily mean that you're going to have a positive experience. And making sure that as much as you can, that this provider is right for you, because there is that big power differential. And I appreciate what you said about the importance of preparing questions, perhaps walking in with a list. Another thing that I've recommended is, do you have a trusted someone who can go with you? Because sometimes we're taking in so much information and then we just completely miss pieces and walk out and go, what? Oh, no, I forgot to ask that. And making sure that you have those considerations managed as much as you can. And going back to one of the other points that you had brought up, the emotionality around the surgery itself. Everybody is going to have different feelings about this. You had joined us previously for an episode discussing grief and gender transition, and I certainly want to encourage any of our listeners to take a listen to that because Zander really dives deep and makes some very important points about these considerations. It's one thing to talk about surgery and to fantasize about it. It's a whole nother to then consider the potential disruption to your life while you are having the procedure, while you're healing. How is your support network going to be? And also the points that you made in our prior interview about all these feelings that might bubble up that are sometimes hard to work through. Can you spend a little time there and how you're Like, are there any tools that you use? Are there any particular methods that you like? Is it narrative therapy? Is it, pros and cons lists? Like, what are the things that you do to really help clients process these very potentially big feelings about going through a surgical procedure and the potential permanence of that?
I am a big fan of pro-con lists. I think it's also, as a social worker, psychoeducation is foundational to the work that we do. And so I feel like it's perfectly legitimate as a social worker who's working as a psychotherapist to provide psychoeducation to our clients. And so I think it's important for clients to know that if they are a person who is either a smoker or vapor with a nicotine-containing product, or they're chewing nicotine gum, or wearing a nicotine patch, most surgeons will not do surgery on somebody who has nicotine in their system for upwards of 4 to 6 weeks before the surgery. So a lot of times they'll do a test right then and there pre-op to see if there's nicotine in the system. And the reason they do that is because nicotine constricts the blood vessels. And you don't want your blood vessels constricted when you are healing from a surgery. You need as much openness in those blood vessels in order for all the healthy stuff that needs to get to those places where surgery was happening for them to heal more robustly, right? Another thing is talking to people about addictions, right? And different coping mechanisms that could be injurious to a post-op person, right? If you're having a stressful experience, what are your coping mechanisms? And how might they impact your recovery period? For some surgeons, BMI is going to be a factor. And so not a lot of people don't like to hear that necessarily. And people will even say there's not a lot of research on that. The thing is, if you've made a determination that you want to see that surgeon for that surgery, and that surgeon says your BMI is too high currently, you need to lower your BMI, which is body mass index, right? So that means that you have more weight on your body. And the reason that they have these precautions is because when you're under general anesthesia and all this medicine is running through your body, there's something about the degree to which we have fat in our systems and how that might impact our healing, our recovery period, right? And so, and again, you mentioned it, I've mentioned it, having a support network. The grief is really interesting as an element of this, in that if you think about a client who's just so excited, they're so excited, they can't wait, they're almost impatient. They don't like that there's a waiting list of 6 months or a year or 2 years or 3 years. It depends on the surgery and the surgeon, right? And all of a sudden they go through with the surgery and they're experiencing grief. It's like they're confused. Why am I feeling a sense of loss after going through something I said I wanted, I felt I wanted? I think there's two components to that. One, there's a lesser known phenomenon of post-anesthesia depression. So sometimes people are just having a low mood as a result of having the general anesthesia, right? All the medications that they give you when you're in surgery to keep you unconscious, right? And so some people, when they come out of surgery, can have a low period because of those medications that are in their body still. But there is also the occurrence where people felt really strongly about having surgery, and then all of a sudden they realized, oh, I think I made a mistake. And that might be momentarily, it might be short term. I mean, I could tell you after I had my phalloplasty surgery, I ended up with a pretty significant complication, what you'd consider a moderate level complication. And there were times when I thought, did I really need to do this? Could I have avoided this? Now, those things they weren't the predominant thought that I was having, but the fact that they come into our thoughts, I think, is legitimate, and we should be able to talk to people about it. We should be able to have a therapist who understands that, yes, I was excited. Yes, as of now, I have no regrets. However, I am feeling a little sad about it, or I'm feeling some uncertainty about it. And to be able to help walk them through, well, what are you uncertain about? Where's the sadness coming from? I think too often, as I mentioned in the talking about grief and ambiguous loss in the last training, was that there are too often people in our lives, including our clinicians, who don't want us to talk about grief and loss as a trans person. And I find that very problematic, because grief and loss is just a part of life. And we should be able to express it and have people help us walk through it, or else we're going to get stuck in it. And so I think it's the same thing. It's the same thing with surgery. There are going to be people who have short-term sense of grief or loss. And then there are going to be people who have an indefinite or permanent sense of grief and loss. And then there are also then going to be people who are feeling like they shouldn't have ever had that surgery. That's a small number of people, but they do exist. And so they should also then have a place where they can go and talk to somebody. There are people who are actually going to come to a place of regretting the surgery that they had. And that's not unique to trans people and trans surgeries, right? There are people who have all kinds of different surgeries and that are not emergency based, right? Not like getting an appendectomy, right? Because your appendix is about to burst, right? Not an emergency surgery, but anything that would be considered elective. And in some cases, even cosmetic, right? There are different cosmetic surgeries. We're not talking about those. We're talking about elective surgeries. So these are surgeries that are medically necessary, but not emergency surgeries. And so sometimes things happen and people can feel grief and loss because of the complications that they end up with. And complications are a natural part of surgery. Our bodies heal in individual ways. So I can stand in a room full of trans men who have all had top surgery from the same surgeon in the same year, and we will all have slightly different variations on the contour of our chest and the recovery period length of time. That's just normal. That's to be expected. So it's when we're only getting information from, a clinician who has very little exposure to trans people who've had surgery, and we're getting information from a few people in our trans community who have had very limited exposure to trans surgery, we're not going to know the broad range of possible outcomes and experiences. It's vast. It's as individual as we are individuals.
I appreciate you bringing up the different feelings that can come up. Another sensation that I've heard talked about in the clinical community is sometimes an increase in dysphoria, that the idea of going through a procedure or needing to go through a procedure in order to feel comfortable and feel secure in your body can sometimes bring up a lot of feelings. And I appreciate what you're saying of like, let's invite them in, whatever they are, whether that's grief, whether that's sadness, whether that's anger, whatever it is, because our offices really should be the place where that's permitted and welcomed, perhaps more than any other place. Like if my joke with clients is always like, oh, you're crying and you're upset, that means I get gold stars from our session. Like you brought it in.
Right. I mean, the thing is that we can always have in the back of our minds, what we hope for the client, what we desire for the client, what we wish for them. But ultimately, this is them, right? This is their body. And they are the ones who need to make the decision. And if it's not the right decision for them, we also have to trust that they're going to be talking to other individuals before they actually have their surgery, right? They're going to be talking to a nurse. Then they're going to be talking to the surgeon. And so the surgeon is going to be able to tell them, well, based on your body shape and size, here are the two options, right? So it's not as if they're going to know everything they need to know before they go see the surgeon. The surgeons and the nurses that are working with the surgeons who do, the office pre-op visit, they're going to be able to provide even more information that is outside of our skill set, right? We're not medical doctors. So there's only so much we can cover, and we hope that the medical providers are doing their due diligence with informed consent to provide as much information. But you know what? If we don't go in with questions, we're probably not going to get as much information as we really need to have to make an informed decision.
I'm glad you brought up that point. And of course, every office is different and their bandwidth or capacity for answering questions may be different. In what I call a past life, I was a surgical coordinator, not for a surgeon who did this type of surgery, but my job was to answer these questions and to do the best that I could to make sure that people felt like they could make an informed decision. Because there is so much at stake. As you said, like not everything always goes perfectly. And sometimes what we go in with and what we get are different. And then what are the feelings that come up from it? And at least for my position and the office where I worked, we took those things really seriously, and that idea of embodied, if you will, informed consent. And I think that also, in a perfect world, would be part of the selection process of like, how do we know a doctor is right for us? And I think it is difficult if you're particularly in a community where there aren't many providers that you feel like you can go to. And so sometimes I might feel we get stuck. But so if that is that marinade, let's say, where you're working, how can we as clinicians help support you to ask the right questions or kind of work within that doctor's framework to still feel like you're being held and that you're being nurtured? And the fact of the matter is, when we're looking at surgical outcomes of any kind of surgery, patients heal better and have fewer complications when they feel like their doctor cares about them and that their doctor is listening. And so I think those things are really important. So I'm glad
Absolutely.
you bring up that point.
Well, there's one place, it used to be that there were national conferences where you could go and many surgeons from around the country would be present, and they would do a workshop where they would show images of pre-op and post-op, and they would talk about outcomes, and they would talk about the procedures, and they would answer questions from the audience. And then, in addition to those national conferences, then we started getting regional conferences and then local conferences. And so it's likely that somebody doesn't have to travel as far anymore to be able to go to a college or university that's hosting a conference in the local area that is showcasing surgeons from that local area so that people know what's available. Or even if you live in an area that has like a LGBT community center, they probably have a resource directory. Many of these centers now have a trans-specific services component, and that individual or those individuals that work for that service line are going to be able to provide information, or they're going to be able to provide a referral, or a warm handoff to somebody in the community who's more knowledgeable about those surgeons and what they do and where they're located. So it used to be really hard to locate, these people, pre-internet, and also expansion of these conferences, these medical conferences.
Thank you. In therapy, we can't possibly predict everywhere that a client's life and story may go. So you could have a clinician who does not consider themselves expert in working with the queer community and is not particularly well trained in it. And then a client says, let's talk about my gender identity. I think I'm trans. And so then the therapist goes out, gets additional training, and potentially even says to the client, I'm not an expert in this. Do you want referrals for somebody else? Or maybe they even self-select. But I'm imagining a long-term relationship with a client, and the client says, no, I don't want to see anybody else. I want to go through this with you. For those clinicians who don't necessarily specialize in this, outside of some of the resources that you've recommended, I mean, like when a client is going through this, do you recommend bringing in a gender therapist in addition to the standard run-of-the-mill therapy that the person has been doing? Or do you feel like a clinician can get enough information to be supportive during that time period, even if they're not highly specialized?
I think the option of referring a client to somebody who specializes in working with trans individuals is one option, because right, as long as that's what the only thing they're working on with that other therapist, right, in order for the client to not deal with seeing two therapists at the same time with overlap. But the other option, and this one I think is fairly popular because I do get a lot of calls for this service, which is you can consult with somebody who is knowledgeable right? And so that's a lot of what I do is I consult with other clinicians who are less familiar and want to be able to provide their clients with more resources and more information, and but they might not have the bandwidth to go and do extra training, and there might not be a gender therapist in their local area. Although nowadays, we can do virtual, therapy much more easily. But sometimes it's just consultation, which again is not out of the ordinary, right? Therapists often will consult with somebody who has an expertise or specialization in working with a particular population, and they work with them once or twice or 6 times or on an ongoing basis because they find themselves getting more and more clients from that population. So I think that that's another option.
Thank you. I appreciate that. We've talked a little bit about kind of the emotional preparation and some of the pieces to ideally work through as they're coming up with clients when they're a little earlier in this process. You've mentioned letter writing. Can you speak a little bit about how letter writing, as we record this in 2024, kind of fits into the process and what that means for clinicians who really don't know much about the considerations when considering these surgeries?
Absolutely. So oftentimes a surgeon will tell a potential patient, or the patient will, or the client will find it on the surgeon's website, that they require a letter from a mental health provider in order to go forward. Now, it depends on which surgery we're talking about, right? So for the top surgeries, right, chest reconstruction, breast augmentation, the surgeon might just want one letter from a master's level mental health provider. For the genital reconstruction surgeries or bottom surgeries, oftentimes surgeons might want 2 letters from 2 different providers. And so that means your provider would just refer you one time over to somebody just for another assessment for readiness, right? And also to make sure that you have, all your ducks in a row, that that you're going to need a bunch of time off work, and how are you going to be able to afford that, and who's going to be there for you, because you might have difficulty with standing up and walking around and remembering to take your medications, getting to appointments, these kinds of things. And so they want to make sure that people understand that, and they're putting their plans into place. And so oftentimes, what I've noticed nowadays, it used to be we need a letter, but there was no more information about that. And oftentimes nowadays, surgeons will have links to an example of a letter, or they will have a template of a letter. And so when I was working, doing gender therapy, people would often bring me in a template from their surgeon, because each surgeon is different. And so some surgeons are going to want specific information that other surgeons don't seem to be asking for. Now there is, I think through WPATH, World Professional Association for Transgender Health, I do believe they have letter writing courses that people can take. And there's also some templates for what would be considered somewhat of a generic letter for surgeries and hormones. But that's a different topic. So there's all these different options. I can tell you, when I worked with the Navy, when we had active duty service members who went out into the community and saw a therapist there rather than somebody on base, they would come back to us or with a letter, or I would be sent a letter from that therapist, and it would be like one paragraph. And I'd have to send it back and say, oh, I'm sorry, we can't accept that. And I would send them our template from our mental health providers on the transgender care team, which was like a 3-page document that they needed to fill in all the blanks. And they needed to individualize it, right, for that specific patient. So they couldn't just leave him, her, right? It was like you needed to tailor it to that particular patient. And so each surgeon is going to be different. So it's really helpful to say to the client, well, have you selected a surgeon? Do you know what that surgeon's office requirement is in order to move forward with that surgeon? Do they need a letter from me? And if they say, well, I don't know, it's like, Well, between this session and next session, your homework is to go to their website and see if you can find it and find that information. If you can't, to call the office and ask that question. Does the surgeon require a letter? And if they say yes, then ask them, do they have a very specific template that they would like my therapist to follow? Yes or no? And if the answer is yes, then say, can you please send me that, and give them your email address, because you want to be able to, you don't want the therapist to write a letter that then gets rejected from the surgeon's office, right? So might as well just get ahead of it. And I know that's a lot to ask. There are people who hate to get on the telephone and talk with a doctor's office, right? They're intimidated about that, or they're just unfamiliar, or they have, social skills that are lacking. For whatever reason, they might have, some hesitancy to make that phone call, but it's going to save them time in the long run if they do make that phone call.
Thank you. I appreciate you bringing up that point. Earlier, you had mentioned a little bit about some of the financial aspects of this. You've already mentioned kind of considerations about taking time off of work or school. Can you speak a little bit about that? Because, as it stands as we're recording this, there are certainly intricacies toward what surgeries will be covered by insurance. Does a person even have insurance? What type of insurance will cover it? What won't? Can you speak a little bit about that?
Sure. So one of the advantages of the Affordable Care Act, or what people call the Obamacare, is that trans surgeries, many of them are now covered under the Affordable Care Act, which means that insurance companies cannot deny those surgeries. Now, some insurance companies cover it 100%. Some only cover 80% or 50%. So we need to know what our specific plan states about what it does and doesn't cover and how much of the surgery is covered and everything else around it. The medications that you need after your surgery, like pain medications and maybe antibiotics. And also if you need to travel to the surgeon, is that covered, right? The airfare if you need to fly to see a surgeon, the lodging if you need to stay locally, right? There are some surgeons that, for example, when they do general reconstruction surgeries, they require you to stay in the local area for 30 days. That means if that's not where you live, you're going to have to fly there and stay there in an Airbnb or a hotel or something, right, with a friend for 30 days. And so that's an expense that you would hope the insurance will cover, but not all do. But sometimes you have to dig a little deeper, right? So just like you might need to call a surgeon's office to find out if they require a letter, your clients might also have to call the insurance company, and they might even have to speak with a supervisor or a case manager who specializes on navigating the system with trans members or customers to help them get the information that they need about what is and what isn't covered. So for people who don't have health insurance but may be eligible for Medicaid, some states, their Medicaid does cover trans-related surgeries. Some states do not. There's also for the individuals who are permanently disabled or seniors who are on Medicare. Some procedures are covered by Medicare, but the issue then between Medicaid and Medicare is which surgeons accept those plans. So typically a private surgeon, right, who's not affiliated with a medical center or a large hospital or any government entity, is not going to take Medicaid or Medicare because it reimburses at too low of a rate. They're going to require that you have health insurance or that you are covered through your employer through what's called self-pay plans, or you're out of pocket, right? And so the out-of-pocket cost typically is much lower than the insurance cost. So when you hear about how much a person's insurance paid, that's not necessarily how much you would pay if you have a out-of-pocket pay. So just know that there's some negotiation room when you're a cash payment person. And so that's how it works with the different insurance companies. Everything is state to state. right? So although the Affordable Care Act or Obamacare is nationally in effect, each state has its own regulation bodies, and each employer has its own insurance providers. And so it gets a little tricky because of how we do healthcare in the United States in particular. So there's a lot of bureaucratic navigation that our clients might need to deal with. There are, of course, local and regional and national individuals or agencies or organizations that help people do that, and so that can be helpful for people is to be able to locate some of these entities that can help us walk through some of these issues. Because it's like if I have Blue Cross Blue Shield through my employer and my friend has Blue Cross Blue Shield through their employer, we don't necessarily have the same plan. Right, we don't have the same plan, so we need to keep that in mind. And then, so that's the specifics about, so if you're insurance or if you have Medicaid or Medicare, if you have a self-pay plan, which is people who have self-pay plans, they know it. They're a lot of these big tech companies do what's called self-pay. And so they cover the cost for people who don't have insurance plans. Some companies don't offer insurance to their employees. They're just called self-pay. It's a different system. And then there are nonprofit organizations that provide for money for surgery, grants, maybe even low or no interest loans. There's several of them. So people would just have to do like a Google search or an internet search to find something like, surgery funds, transgender surgery funds, or grants. Some of these organizations give out, a dozen or 2 dozen every year. So they give out a lot of money, thankfully. So that's good to know that more and more of these organizations exist.
Thank you. Thank you for covering some of those resources because I think it's easy to miss them. And another resource that I have found helpful in larger cities, depending where you are, there are often nonprofits that even if they don't have those grants available, may have somebody there who can help from a case management perspective and can say, okay, let's connect you with the ombudsman at the hospital so that we can try to anticipate what to expect with the surgeon, or we can try to talk to the department about what the discharge process is going to look like, or more information about aftercare, for example. So I've been able to find those resources as well within these larger, like I said, larger cities, larger metro areas will often have at least one nonprofit that does this kind of work that may be able to complement the services that you're providing from a case management perspective.
Absolutely. An organization that I recommend people, if people want to know more about how insurance works and how to navigate through the insurance process, they can go to transhealthproject.org, and they have a feature on their website called Trans Health Insurance Tutorial. And that really does help people walk through, choosing a plan, understanding your plan, how to apply for coverage, understanding, getting authorization beforehand, how to deal with a denial. So there's a lot of resources on that webpage. Again, it's transhealthproject.org.
Zander, I am so grateful for the things that you've covered during the hour that we've spent together. You've recommended a number of resources, and I want to restate them. You had mentioned WPATH. You'd also mentioned transhealthcare.org, in addition to the resource that you just mentioned. Are there any other books, periodicals, podcasts that you find are really helpful for clinicians who are supporting clients who are going through medical transition?
Well, one of the benefits of having like the transhealthcare.org website available for clients is that from that one website, it takes you to several other websites that are surgery specific. And so one of the things, like if you went to topsurgery.net, which is one of the places it would send you to, not only does it talk about all the different surgery types and the different surgeons and who takes what insurance, there's also a place on there. There's a resource tab on there that when you click on it, it tells you about these Zoom rooms and these Discord groups and these Facebook groups and books and blogs, right, that are specific to that type of surgery, so that people have all of these options of where they can connect. So like some of the blogs are individuals who talked about their experience, right? And so I would hope that nowadays, with the way the podcasts work, that there would be, that would also then be something, that's going to be listed on there.
Thank you, Zander. And for folks who want to learn more specifically about you and about your work, what's the best way to do that?
I have a website. It's zanderkeig.net, so zanderkeig.net. I'm also on LinkedIn. That's my only social media, so people can definitely send me a connect notice through LinkedIn, and I'd be happy to connect with them. There's also a contact form on my website, again, zanderkeig.net, and I respond to direct messages in LinkedIn and people who email me through the contact form.
Fantastic. Zander, this has been so helpful and just lovely to have you again. Thank you for your time. You've covered so many points that I think are very important, and I just appreciate you coming back and sharing this with us, and also encourage our listeners to listen to Zander's other episode talking about gender transition and grief. Thank you again, Zander.
You're welcome. Thank you.
You've just finished listening to another exclusive continuing ed podcast by Clearly Clinical. If you like what you just heard and you need continuing ed credits, please visit us at clearlyclinical.com to check out our one-year membership, where you'll have access to our growing library of continuing ed podcast courses. Clearly Clinical, where our goal is to help you learn, grow, and shine.